Lung cancer is the leading cause of cancer deaths in the world, in the country, and right here in North Carolina as well. Researchers say 1 in 16 people will be diagnosed with lung cancer in their lifetime. And of those cases, 21% of those patients are expected to die from their diagnosis. WFMY News 2's Sydney Moore spoke with a woman from High Point who has fought to beat those statistics.
High Point is home for 66-year-old Kathy Davis.
Lived here for quite a while now.
It's where you can find her spending time with her plants and family.
Real close to my mom and my brother and my sisters.
Her loved ones live right around the corner. The fellowship keeps her going.
Go with my sister and do things with her. Mostly we're into painting right now at her house.
It's moments like this she never thought she'd experience.
If I hadn't quit smoking when I did, honey, I would not be here talking to you.
And not taking things for granted comes easy. Davis was diagnosed with stage 4 lung cancer in 2005 at 44 years old.
And I was told that I didn't have but 6 to 9 months to live.
The cancer spread from her lungs to her brain and stomach.
They wound up doing surgery on my intestines and taking pieces of my intestines out, the cancer. They wound up giving me gamma knife for my head.
Digestion problems initially led her to the doctor's office.
They told me they would do an x-ray of my chest, and they put me on a treadmill to check my heart and all that, and they said it wasn't my heart. So I said, well, I know what it is then, because my father.
Davis has a long history of loved ones who smoke.
The whole family smoked. I mean, the father, the mother, you know, everybody smoked. And so when we got old enough, you know, that's the thing we were doing.
Her father and one of her sisters ended up being diagnosed with lung cancer too. Sadly, they lost the battle.
I tried to quit smoking after my father passed because I was so worried about it, you know.
Her father didn't live 1 year after his diagnosis, but for her, she's made it past 18 years.
Doing a lot of praying and asking God to help me with this because it was going to take everything He could help me with to do it. So I finally quit.
Dr. Mohamed Mohamed, an oncologist with Cone Health, has helped Davis through her journey.
There are people who would beat that odd of the 1 or 2 year survival, and they will be here for many, many years. And that's why I encourage people to try their best, stay positive, fight the cancer, and you never know.
He says certain treatments and Davis's desire to fight helped her get through nearly 2 decades.
She received chemo, she received radiation, she received surgery to the tumor when it spread to the small intestine. So we applied all the modalities that we could have for her.
Davis is proud to say she only has to visit her doctor for checkups once a year.
I haven't had a treatment since 2011. And so from the good doctors, and God blessing me, I'm still here.
She really almost cured of the cancer.
She often finds herself talking to God in shock for making it through so many years with stage 4 cancer.
My mom, she always tells me, well, it's because He knowed I needed you, you know, to help me.
She realizes now it's to be there for the ones who love her most.
She certainly defied the odds. We love seeing that kind of story, Dr. Mohamed. Dr. Mohamed is a thoracic medical oncologist with Cone Health Cancer Center and an expert in the lung cancer field. Let's just start with this. We just watched her story, but a lot of people would say, well, maybe I don't think I'm at risk for lung cancer because I don't smoke and I don't have to worry about that.
Yeah, Tanya, thank you for having me, and thank you for sharing the story of Miss Davis. It actually gives a lot of hope for our patient who unfortunately get diagnosed with lung cancer. As you mentioned, lung cancer is the leading cause of death among all cancer, and it's a large number of patients that get diagnosed with lung cancer every year. As you mentioned, 1 in 16 people have a lifetime risk for lung cancer. But again, the risk for lung cancer can happen to anyone. It can happen to smoker and non-smoker. And unfortunately, every year we have around 40 to 50,000 patients diagnosed with lung cancer who never smoked a cigarette in their life. So it's, as one of my patients said, if you have lung, you can get lung cancer. So it's not really limited to smoker. it's a disease that can happen to any one of us.
All right, well then let's kind of unpack all of that. Let's talk about what are the signs maybe to look for.
Yes. First, before I really talk about the sign, I really like to get people diagnosed with lung cancer before they have a sign of it. And the criteria, we have criteria now that has been going on for several years for screening patient for lung cancer. It's limited to patients who have a history of smoking, and I'm going to go over the criteria again. These are the patient age 50 to 80. Patient who smoke 20 back years of smoking, which mean one bag for 20 years or two bags for 10 years, and patients who are a currently smoker or quit smoking less than 15 years ago. We like to see these patients before they have symptoms, because the moment they have symptoms, it's already advanced stage. We like to see lung cancer patient earlier than having a late stage. So the symptoms and signs could be starting with some cough. They could start with shortness of breath. They could have some other, symptoms, coughing blood, chest pain. There are general symptoms for any cancer, not just lung cancer, and that could be weight loss, unintentional weight loss, or people who have, significant decline in their condition with no explanation.
All right, so you made it clear that if you have the criteria for lung cancer, you need to be seeing your doctor for sure so that you can kind of be screened on a much more consistent basis. But if you don't have any of those criteria and you have some of the symptoms that you just mentioned, what should you do? Who should you be contacting?
Yeah, definitely seeing your family doctor is the first step. If you have symptoms that doesn't go away, you have cough that persisted, even if you are never a smoker, and you have a cough that persisted, that taken longer than expected for a cold or flu symptoms, you need really to be checked and get some imaging studies done at some point. Definitely primary care physician is the first step. But if no, if you don't get the help you want, you may need to go and see a specialist like a pulmonologist who would probably take it from there. We're lucky at Cone Health that we have a great screening program for our lung cancer patient, but we also have a pulmonary nodule clinic, and we also have the pulmonary section of Cone Health is very active in checking to see patients who may have the possibility of lung cancer. So we have a way to address these issues.
All right, let's talk about early detection, because we hear that over and over again, no matter what kind of cancer awareness we're talking about.
Yes, again, I mentioned the criteria for the early detection, and I'm going to repeat it one more time. If you are current smoker or former smoker who smoked then 20 back year history, and you are at the age of 50 to 80, you really need to get screened. You need to reach out to your family doctor. Many of them are really smart guys, and they know the criteria because it's guideline. It's not something that we invent. So they're gonna really check you for screening for your lung cancer, but you may need to initiate it. As a busy primary care physician, he may forget it, during the visit. But if you initiate and said, hey, I'm a smoker and I smoke for a long time, can I get the CT screening done? And that will be the way to detect it early. If you are a non-smoker and you have symptoms that persisted and did not disappear, please make sure that you get some imaging studies at some point.
Okay, and we'll talk about some of those stats and things for early detection and much more when we come back after the